So, hello everyone. Today we want to present is the appropriate rehabilitation protocol and controversial issue of conservative and post-surgical sport rehabilitation. So, for the case presentation, we can see Sophia is a 15 years old female figure skater diagnosed with bilateral OS triangular syndrome, posterior ankle impingement, and flexor hallucis longus tendinopathies. Symptoms include posterior ankle pain exacerbated by plantar flexion during jump and spins, swelling, and limited range of motion, so occurring during her competitive season. This condition is common in athletes like figure skaters due to repetitive forced plantar flexion. So for the next slide is understanding the condition. So for the OS triangular syndrome, an accessory bone like the OS triangulum behind the talus causes impingement in plantar flexion. So for the prevalence, 1.7 to 7% in general population, higher in ethnic. So for the posterior ankle impingement, compression of posterior ankle structure like bone, soft tissue during maximal plantar flexion. So for the FHL tendinopathies, the inflammation of the FHL tendon often concurrent, leading to pain, crepitus, and checkered too. In figure skaters, linked to repetitive motion and boot pressure. So for the critical analysis is the bilateral improvement in a young athlete, increased risk of current issue if unmanaged. So early intervention key is to prevent the progression. So for the next slide is the treatment decision. For the justification for Sophia, conservative treatment is recommended entirely over surgical intervention. So because she's 15 years as a young athlete responded well to conservative measure and avoiding surgical risk like growth plate disruption. So for the competitive season, like surgery involves 5 to 12 weeks recovery, potentially ending her season. Conservative allows modified training continuation. And for the evidence, the conservative effects in 33 to 60% of case with rest and injection providing relief in 4 to 6 weeks. If no improvement after 6 weeks, surgical extension of OS triangulum with FHL release bilateral natural fever stated approach if surgically needed. And for the critical analysis, literature support the choice of conservative care first, as surgery has 98% return to sport related but higher institute downtime. And for the next slide is conservative rehabilitation protocol. So here is the week 0 to 2 is the phase 1 acute pain and inflammation control, and week 2 to 4 is phase 2, and for the strength restoration and for the subacute mobility. And for the third one is to return to sport and yep. So for the week 0 to 2, we will do the joint mobilization to talus and calcaneus, like doing some plantar flexion or dorsiflexion slightly. So for the week 2 to 4, we will do some strengthening exercise like mini squat and single leg stand. And for the week 4 to 8, we will do the advanced calf strengthening like single leg rise and single leg jumps controlled and some propulsion and balance exercise. So for the conservative rehabilitation protocol, we will have a demonstrate video here and demonstrate how to do the exercise.
Post surgery rehab protocol. Phase 1 to the acute the pain, the exercise to the ankle pump, and then the sit and toe. Phase 2 the exercise the using the stationary bite and balance progression is standing hills with support and standing lunges and single leg stand. And phase 3 the full ROM to single leg half squat, the natural the single leg lunges jump, and then the natural jump bonsu for the double leg pass ball, bonsu the single leg pass ball, the agility to the single leg jump side to side, and for the swing running to the landing and then box jump. Okay, to the I give the video link on the post the surgery rehab program protocol on where I will open again now. Okay, the next to the concern issue, commonly to the first line mean to the downtime, but maybe prolong the syndrome in the effectively with the incomplete resource in the complete demand. Surgery to the fast defense to relieve 98 return, but the covertly over early eversion to the teens due to the quit to concern and the season degradation. And issue two to the open the emphasis to open the traditional good the access to but the higher mobilities emphasis to the mean the emphasis faster recover lower competition but the technical demand preferred for the athlete. Cited analysis to the Soviet efficiency if the need the balance with to the very quick the return and then the console and I hope to the full range of motion to the protocol to emphasize to face the progression for the opinion recover. This is thank you of my presentation. Thank you.